Good evening. This is All India Radio Kohima. I'm Jonas Yantan with Evening News. The headlines. Total confirmed coronavirus cases in India crosses 10,300. Death toll stands at 339. Prime Minister Narendra Modi extends nationwide lockdown till 3rd of next month. Governor N Ravi reviews preparedness of Nagaland to tackle COVID-19. Assures government's commitment to mitigate hardships of people during lockdown. And Naga Hospital Kohima ready to treat COVID-19 patients. The total COVID-19 cases in the country has reached 10,363, with the active cases standing at 8,988. According to Ministry of Health and Family Welfare, of the total cases, 1,035 have been discharged from hospitals after being cured, while the death toll stands at 339, while one have migrated. The central government has decided to continue the nationwide lockdown till 3rd of next month, an extension of 19 more days in the fight against novel coronavirus. Addressing the nation today, Prime Minister Narendra Modi said stakeholders, including states and people, have favoured extension of the lockdown. He said integrated and holistic approach has helped India to handle the situation properly. He further said tight vigil will be kept on all hotspots and containment zones, and strict implementation of the lockdown will be ensured in the coming days so that the virus does not spread to new areas. He added that all districts, localities and states will be closely monitored over its performance with respect to implementation of the lockdown norms and management of hotspots till 20th of this month. The Prime Minister said after 20th April, states will not have hotspots or which have not allowed hotspots to come up. They could be allowed with certain conditions to let some important activities resume. Prime Minister Narendra Modi, while speaking on the lockdown, lauded the patience and discipline of citizens in making the lockdown successful. He said early preparedness helped the country in effective containment of infection. He sought people's support in 7 things, including take care of elderly, maintaining social distancing, and helping the poor. He also urged people to respect corona warriors, the doctors, nurses, sweepers, and police personnel. He appealed to citizens to be kind to their workers in their business and industry and not to terminate them in case of financial hardships. Prime Minister said holistic and integrated approach and timely decisions have put the country in a much better position compared to most of the developed countries in terms of the number of people infected. Nagaland Governor N Ravi today reviewed the unfolding COVID-19 situation and assessed the preparedness of the state to tackle the virus. The weekly review meeting at Kohima was attended by Chief Secretary, Principal Secretary Home, Commissioner and Secretary Health and Family Welfare, and Director General of Police. In the backdrop of a COVID-19 positive case in Dimapur, the meeting identified the gaps and weaknesses in the existing preventive protocols and procedures to fight the virus, while also stressing on the need to take appropriate measures to further strengthen the existing mechanism. For an effective holistic response to this unprecedented global crisis, the Governor suggested immediate setting up of a multi-department COVID-19 war room under the Chief Secretary. It will closely monitor aggressive tracing, tracking and testing of suspect cases and also do the real-time stock-taking of medical inventories. During the meeting, the Governor, while expressing that the lockdown will create a lot of humanitarian issues, however, reassured that the government remains committed to mitigating the hardships of the people and taking all possible measures in this regard. Governor also reassured the people of Nagaland that the state government under the leadership of Chief Minister Neperial is taking all measures to effectively tackle the COVID-19 pandemic. The Governor also thanked the Prime Minister Narendra Modi for the right decision to extend the nationwide lockdown till 3rd of next month. This news comes to you from All India Radio, Kohima. Following the Dimapur incident where a patient was referred to Guwahati and was tested positive for COVID-19, Naga Hospital Kohima the designated COVID-19 hospital is ready and prepared to treat positive patients. This was informed by PROs of COVID-19 Hospital Kohima, Dr. Sentimeran and Dr. Pyansatang, this afternoon. They informed that the hospital is ready with 67 beds to take positive cases, another 40 beds at Chetama and 95 beds at quarantine facility Merima, which has the capacity to be upgraded to 200 beds. The medical officers informed that NHAK at present has 9 ventilators, including one at Chetama, and about 300 personal protective equipments, PPEs, of different qualities. They also said that with 3,000 Macintosh provided by Police Department, the NHAK is trying to indigenously improvise the PPEs which are currently being stitched by the police personnel. Highlighting the status of COVID-suspected patients at NHAK from 24th of last month till yesterday, Dr. Pyansatang said a total of 197 suspected cases were received, out of which 53 samples were sent for testing. Among those, 30 have tested negative, while the result of 23 samples were awaited till the time of filing of this report. Nagaland government has introduced a website to connect to all Nagas living outside the state of Nagaland and in need of assistance due to the ongoing lockdown on COVID-19 pandemic. The website is managed by the Department of Information Technology and Communication, Nagaland. In the website, it said one can share their concerns so that the government can provide help and assistance where possible. However, it also said posting on the site may not guarantee any help, but an utmost attempt will be made to reach out to the needs of the citizens. It also said the government will try to see possible options to see the nearest centers from where you can be helped at the earliest. Any Naga who is stranded or staying outside the state can seek assistance for facilities on health and medicines, food and supplies, accommodations and financial assistance by getting into the link iamstranded.nagaland.gov.in. In regard to the total lockdown, including restriction on movement of vehicles in Woka district, Deputy Commissioner Orentang Lota has ordered fumigation of trucks and Tata Mobile carrying essential commodities with effect from today. In an order, the DC said all trucks and Tata Mobile carrying essential commodities from Mugukchung and Kohima routes are to report and halt at public ground Woka for disinfection. The fumigation process will start from 7 a.m. and only the disinfected vehicles will be allowed to unload the goods. The checkpost at Satspen towards Kohima route and Jukudung towards Mugukchung route is to maintain record of the trucks carrying essential commodities. The DC also cautioned that no trucks will be allowed to ferry any passenger other than the authorized driver and the handyman. The Deputy Commissioner Mugukchung has completely banned inter-district vehicular movement except for those designated vehicles carrying essential commodities. Officials on COVID-19 duty as per the exempted list issued by the government and medical emergencies with travel permit from the concerned Deputy Commissioner of the district and supporting medical referral documents. In an order, the DC Mugukchung said that an additional checkpost will be established at Aulichan in Mugukchung to be manned by police and medical surveillance personnel. Violators will be booked under Section 188 of the IPC. Nation today remembered Dr. Bhimrao Ambedkar on his 129th birth anniversary. Dr. Ambedkar is known as the chief architect of the Indian Constitution and has been bestowed with the country's highest civilian honor, Bharat Ratna, in 1990 posthumously. And now 20 news, here are the main points again. Total confirmed coronavirus cases in India crosses 10,300. Death toll stands at 339. Prime Minister Narendra Modi extends nationwide lockdown till 3rd of next month. Governor N Ravi reviews preparedness of Nagaland to tackle COVID-19. Assures government's commitment to mitigate hardships of people during the lockdown. and Naga Hospital Kohima ready to treat COVID-19 patients. That is all we have in this evening news bulletin. Good night.